Good morning, guys. During a transplantation plan, especially someone has a large bald area whose requirement is more than 4,000 grafts, we recommend second session. So when it comes to second session, a lot of our old videos we spoke about it. Second session we're going to plan it after 6 months because of few reasons. Now, what if we can plan second day or 2 consecutive days, provided patient has a good donor? So there's a little confusion about doing it second day or doing it after 6 months. So I want to clarify those confusions. That's the reason I'm going to make this video. Kindly watch the video until end. Who can do 2 days procedure? Who can go with second session after 6 months? Basically, someone has a large bald area. Usually, we require more number of the grafts. Such cases, because there is a limit of harvestation somewhere 3.5 to 4,000 grafts per day, we need to plan it after 6 months. Here, basically, if the area of the harvestation remains same, minimum gap is 6 months required. If the area of the harvestation is different, then we can plan second session next day itself. That is called 2 consecutive days procedure or 2 days procedure. Usually, provided you have a good grafts in the donor, so scalp especially, we can also plan in 2 days. That means one day we can harvest one side, second day we can harvest second side. By doing this, we can target 5,500 to even 6,000 grafts. Why can't we target more grafts in first day? Because imagine we'll try to harvest more than 4,000 grafts in single day. The survival rate of the grafts will come down, our growth results will be compromised. That's the reason we are going to plan 2 days. In few cases like scenario 2, imagine patient has beard grafts. We can also harvest day 1 scalp grafts, next day beard grafts. With this, we can target more than 7 to 8,000 grafts combined with scalp and beard. In such cases also, we'll do 2 consecutive days procedure, also called as 2 days procedure. Well, who can opt this 2 days procedure or 2 consecutive days procedure is basically someone has a time constraint that they cannot repeatedly travel for second session after 6 months, and someone who really want to get maximum coverage in one session, and someone wants more number of the grafts to be implanted in one session. So all these 3 scenarios, they can think about going for 2 days procedure or 2 consecutive days procedure. So for them, it's going to be added advantage to add more number of grafts in phase 1. Well, when we do a 2 consecutive days procedure, there are few frequently asked questions. Number 1 question is, when you are targeting large number of the grafts, would my donor will damage? That is a question everybody has in their mind. Kindly remember, when we target the grafts, we're going to harvest the grafts within the safe donor limit. When we do so, your donor will not be damaged. Second question is, because we are going to do 2 days procedure, what is the recovery time? Well, when you do either 1 day procedure or 2 days procedure, recovery time almost remains same. Even discomfort levels remains almost same. One should not worry about recovery time delay or any more discomfort. It will be as good as 1 day procedure. Third question is, how does my beard look after beard grafts harvestation? So, well, usually beard recovery will be very fast. You will not have any pain after beard grafts harvestation, and marks will be disappeared within couple of days. So you will look absolutely normal after a couple of days. One should not worry more than that. So in 2 consecutive days, combination of scalp and beard grafts definitely goes well, provided you have good grafts available. Well, who can opt second session after 6 months? Someone has less donor in the scalp where we cannot plan second session second day, or someone doesn't want to use their beard grafts for scalp. These 2 scenarios, they can plan second session after 6 months. In these scenarios, what we can plan is, during first session, we are going to cover the partial area. During second session, we can cover the rest of the area. And some patient has own choice and discretion to get it done their transplantation after 6 months. There's a possibility that they can do second session after 6 months. There are frequently asked questions based on second session done after 6 months. Well, can I undergo during second session after 6 months? Scalp plus beard grafts. That's the question. Yes, well, you can undergo that point of time scalp grafts as well, beard grafts as well. Last FAQ in 2 consecutive days procedure is, suppose you had it done 2 transplant done 2 days, 2 consecutive days. Am I eligible to do another session after 6 months? That's the another question most of the people have in their mind. Yes, once you do 1 day procedure or 2 days procedure, after 6 months, you are eligible to do again scalp and beard grafts. Well, doing your second session, whether second day or 6 months, greatly depends on what kind of baldness you are suffering from and what kind of donor you have with. This kind of examination that happens during the consultation over a phone or during the physical consultation as well. So your doctor will suggest you what are the best plans for your case. So advantages being doing 2 days is, imagine you have a time constraint, you want to travel to a distance place where you cannot come back unnecessarily for the transplantation after 6 months. Definitely you are the one candidate can choose for this kind of 2 consecutive days procedure where you get maximum coverage and maximum number of the grafts will be planned. And with this first session itself, you're going to get a reasonably good coverage. You can postpone the second session later on. That's the main scenario. Or someone has a time constraint because of their personal issues like marriage stuff, or someone is pursuing to the higher studies, they don't want to come back again and get it done. These kind of scenarios, they can think about doing second session, second day itself. Well, here an important point to be noted is, to do this, you have to have at least above average donor from the scalp itself, or you should be supposed to have a good beard donor, and you will be willing to get it done from beard grafts. All this really matters. And however, the complete scenario, each patient varies to patient. Probably your doctor will see and suggest you. Otherwise, it's a very good choice to think about getting done 2 consecutive days procedure. One can definitely achieve a good improvement and good coverage. Thanks for watching our videos. Kindly keep watching our channel to get authenticated information on hair transplant surgeries. Thank you.